Well, there's some good news about the coronavirus vaccines that have been rolled out in the past month. Millions have received vaccinations, but there are long lines and there are millions who want the vaccine and can't get it. In the meantime, several times last week, 4,000 people died in a day, a reality that many more thousands could die in the next few weeks in this country. Joining me now is vaccine expert Dr. Peter Hotez, the Dean of the National School of Tropical Medicine at Baylor College of Medicine. Good to see you, Dr. Hotez. Did I misstate anything about how much more difficult the days ahead are likely to be?
No, you're absolutely right, Cambrell. We're in a dire crisis right now. We're looking at 200,000 to 300,000 new cases a day, and remember what that number really means. That's an underestimate by a factor of 4, because those are confirmed cases. So we're probably looking at a million new cases a day. We're getting 4,000 deaths per day. Right now, COVID-19 is the leading cause of death on a daily basis in the United States, and it's been that way for a couple of months now, and it's only getting worse. And so we're going to be at 400,000 deaths, Americans who lost their lives by the inauguration. That's the number of Americans, GIs, who sacrificed their lives in World War II. We're getting upwards of those kinds of numbers. Maybe 500,000 Americans will lose their lives by April. So this is just horrible, and now we've got to really vaccinate the American people as quickly as we can.
You know, you've talked about this for a while. It was like the doomsday warning. I mean, you just said that we hope that this doesn't happen, but now we're there. People are tired of restrictions right now brought on by the virus. The challenge is balancing safety with the reality of wanting to get back to normal. Your advice about how much longer you think we'll need to toe that line of coronavirus safety?
Well, as soon as we can get a significant percentage of the American people vaccinated, we did a study with a group at City University in New York that finds we need to vaccinate about 3/4 of the American population to vaccinate our way out of this. And, you know, so let's look at an example. Texas, for instance, with 30 million people, that's 24 million Texans we need to vaccinate, say, over the next 6 months. So that's a pretty high bar. That's 4 million Texans every month, and we're just not there yet. We just haven't figured out a way to get that level of scale, and that's what we have to do. And we heard from President-elect Biden last night. He's got a plan in place, which is good, which will include expanding vaccination hubs, which we're a little bit ahead of the game in Houston. Our mayor and county judge have been already thinking about this and putting in place things like vaccinating at Minute Maid Park and the Bayou City Center. So I think that's good. We're going to have to streamline recommendations. We're going to need to get additional vaccines up. But I don't think we're going to be able to do this with the mRNA vaccine technology alone. We've got to get at least 3 or 4 others out there. So it's going to be a tough year. I think we can do it. We just have to be a country again that's willing to do hard things. We've kind of, we've squandered so many opportunities in 2020.
Let's talk about hindsight right now. Normally it's 2020. Try not to do a play on words there, but it's 2020 much of the time. What have we not done that got us to this point?
Well, you know, we failed at every step. We failed to detect the entry of the virus when it came in from Southern Europe into New York City. Transmission went on for a month before anybody realized it. Then we never really got the diagnostic testing up to speed, and we're still struggling to get diagnostic tests. And then we failed to halt that horrible surge that happened across the southern states over the summer. Then we failed again to stop the big fall surge in the Midwest. And, you know, when you look at if you draw a perpendicular and horizontal line through those two surges, guess where they meet? They meet right in Texas. So Texas now, you know, is close to leading the nation in the number of new cases, total cases, 2 million cases. And again, that's an underestimate of 4 or 5. So we're looking at maybe upwards of 8, 9, 10 million Texans have been infected. A third of the state's been infected almost, and 30,000 deaths. So this is the most catastrophic event in modern Texas history in many respects. And now we're still not doing doing the genomic sequencing of the viruses. We've underperformed there as well, so we don't know if things like the UK variant and South African variant are widespread here. We're not looking, even though we've lead the world in genomic sequencing capacity. So at every step, we've sort of blown it, and this is our last chance. And we've got to. This time we can't fail. We've got to vaccinate the American people.
So how hopeful are you now with the change in the administration in terms of the way this pandemic is going to be managed going forward?
Well, at least now there's a plan. You know, when Operation Warp Speed started, we heard about the 4-star military general, and I was excited about that. He was an expert and is an expert in logistics. But I guess I wasn't paying close enough attention, because I thought that meant they were bringing in the U.S. Army or the National Guard to vaccinate the American people. Now we've learned that by logistics, they meant getting the boxes onto the back of the FedEx and UPS trucks and keeping them frozen, which is not trivial, but it's not nearly adequate. Now we've got to put in place that infrastructure. I just wish we'd been doing this for 2020. We should have had it all ready to go by now. And so we've got to scramble. And a lot of stars have to align to make that happen. We have to get those big hubs up like Minute Maid Park and Bayou City Center. I visited the Bayou City Center a couple of weeks ago. It was really well run, very well organized, professional staff, knowledgeable staff. They were ready for all sorts of contingencies. We just need lots of them to make this happen. And I think we're going to have to call on volunteers. You know, what's interesting, Kimberl, is I've gotten so many emails and on social media hearing from retired nurses and docs and other healthcare professionals. Hey, where do I sign up? I'm ready to help. So that's kind of nice. I think, you know, if we're really going to do this, we're going to have to call on our American spirit of volunteerism, and that's going to be important as well. And so a lot's got to happen. I think we can do it. We really have no choice. We've just got, this time we can't falter.
All right. Dr. Hotez, thank you. I want to continue this conversation on Newsmakers Extra, which we love to do here. That's going to be on the Newsmakers page on click2houston.com. We'll do that in a second. Thank you once again.